I wanted to talk about healthcare patient rights. Real quick, this is a very dry topic, so I'm going to try to make it at least a little bit interesting. Also, I want to note that for anyone tuning in internationally, I'm going to keep this general because I know some of these things might not apply to where you live. However, you can always Google the country you live in or province or region, and there's different keywords like patient health rights, healthcare rights, patient bill of rights, patient right codes, and look at how your healthcare rights are protected by law. So in the United States, all of our states have what they call revised codes. I live in the state of Ohio, so for patient rights, it's called Ohio Revised Code of Patient Rights, which is adopted from federal law. And some states in the United States, they have some additional laws protecting patients, and healthcare facilities often will have what they call a patient bill of rights or healthcare policy as far as how patients should be treated. So what I'm going to do is give some nuts and bolts, general information of what our basic healthcare rights are as a patient. Then, because I'm a huge supporter and advocate of sharing our personal stories for a bigger impact, I'm going to then relay some both my own professional experiences and patient experiences in relation to patient rights violations. And professionally, that's not because I violated any patient's rights. All of my jobs, if you don't know, I worked in human services, social services for over 20 years under the intellectual disability and mental health umbrellas. And all of my jobs were about advocacy and care coordination. I even had a job title called the Adult Advocacy Coordinator. With that said, I'm going to share some of those experiences of true examples of patient rights violations, the process I went through to address them. And then towards the end, I'm going to give you some tips to help you hopefully reduce the likelihood of encountering any patient rights issues, so to help minimize that. Also, I know we might have some people tuning in during COVID. I did a lot of research on different topics, and one of those topics was looking and researching in other countries what type of healthcare rights they had in place for patients. I understand that it's not universal and many countries have to progress, and I know that we have warriors who are advocating and fighting for healthcare rights. And I just want to let you know, I stand with you, keep fighting. And I hope if you're tuning in that anything I share, you can use to help strengthen your advocacy efforts to put in place healthcare equity and equality for people in your country. Finally, disclaimer, the information I am presenting today, right now, should not be construed as medical or legal advice. I'm just sharing some personal and professional experiences and some ideas to circumvent or address patient healthcare rights. If you feel that your rights as a patient have been violated, I will give you some information on what you can do as far as contacting a patient advocate. And if it is something of a grievance, patient rights violation, you may want to reach out to a legal attorney or legal representation to discuss a patient rights violation. So with that said, hopefully you all will find this interesting and not too boring, but I feel it's important. So some basic patient healthcare rights is we have the right to be treated with courtesy, respect, and dignity. We have the right to timely access to care and responsive attention to our medical needs, and this also includes referrals and tests when medically appropriate. We also have the right to receive information from our physicians and have the opportunity to discuss the benefits, risks, and costs of appropriate recommended treatment alternatives, including the risks, benefits, and costs if the doctor knows or provider knows the cost of foregoing treatment. Costs kind of go back to your government-funded health systems or private health insurance plans. So most doctors won't be able to tell you that, but their financial patient department could, or your insurance carrier. Patients have the right to be able to expect that their physicians will provide guidance about what they consider the optimal course of action for the patient based on the physician's objective, this will come up later, objective professional judgment. You have the right to question your health status or ask questions about recommended treatments when you do not fully understand what has been described and have their questions answered. So legally, medical providers have to tell you what treatments they're recommending. And this also includes in emergency situations. If you were in the emergency room and incapacitated, they would usually defer to your next of kin, or if you're married, or if you have like a power of attorney on file. You have the right to make decisions about the care the physician recommends and to have those decisions respected. So this means in instances of maybe a doctor wants to prescribe a certain medicine. Here's an example. I'm allergic to the class of meds that are typically prescribed for seizures. And I had a physician trying to prescribe me Lyrica, which falls in that class of medications. And I kept on trying to tell this provider, I'm allergic to this. This is in my notes. Here are the dates when it was documented, the pharmacy. And the doctor wasn't listening. So I just kind of had to take a step back. And then I was like, okay, well, I can't take this medicine. So if you prescribe it, I'm not going to get it filled because I'm allergic to it. You also have the right as a patient to accept or refuse any recommended medical intervention and or treatment. You have the right to have the physician and other staff respect your privacy and confidentiality. You have the right to obtain copies or summaries of your medical records. You also have the right to obtain a second opinion. And I also recommend, if you are making a major medical decision, to get a third opinion. You have the right to be advised of any conflicts of interest that your physician may have in respect to their care of you. You have the right to continuity of care. Patients should be able to expect that their physician will cooperate in coordinating medically indicated care with other healthcare professionals, and that the physician will not discontinue treating them when further treatment is medically indicated without giving sufficient notice and reasonable assistance in making alternative arrangements for medical care. That's just jargon, meaning they put in a referral to another doctor. Typically, that's what it means. The other thing is HIPAA in the United States, which is the Health Insurance Portability and Accountability Act of 1996, also known as HIPAA, is a federal law that was basically created national standards to protect the sensitive patient health information from being disclosed without a patient's consent or knowledge. There are some exceptions in this rule, like in medical emergencies or for continuity of care. As a veteran, I received some of my medical health care services through the VA, so I have actually a whole team. So I have like a PCP and a nurse practitioner, women's health, all this stuff. So within my team, they can communicate about, medical needs or any issues, whatnot, what have you. So with that said, those are some of your basic patient rights. You can Google, you can ask some doctor's offices or medical facilities will have a patient bill of rights that you can ask a copy of if needed, just so you have it, because it's a lot of information to kind of remember and digest. With that said, I'm going to share some examples from both professional and personal experience of patient rights violations that I've encountered and what the violation was and how I addressed it. So, from a professional experience, I was a care coordinator and I would have patients or clients on my caseload that were diagnosed with mental health disorders, and we had a whole treatment team, including a psychiatrist. Now, I'm going to preface this as, in our offices, posted on the walls, it said to the patients that if they are more than 15 minutes late for their scheduled appointment, it may be rescheduled. So this is going to tie in where one of my patients or clients had an appointment first thing in the morning with the psychiatrist. This particular doctor always ran late all the time. And on this particular day, this physician was an hour late. Then the physician put in their clinical note in during the time that my client was with me for a little bit and then the nurse, knocking out their clinical time, which on another tier could be construed as fraudulent billing. And one of the things that was kind of hard for me, because this was the company or the organization, mental health organization that I was working for, is here I am, here's my client, and our organization just basically violated their rights, because we had this expectation of our patients to arrive 15 minutes early, and then we had it posted on the wall that if they were more than 15 minutes late, they could be rescheduled. But yet we had a medical provider who was consistently late every single day, and then putting in the clinical note as if they saw the patient at the right time or an earlier time. So as this person's care coordinator and advocate, I filed a complaint on behalf of the patient at the same place I was working at. And the thing of it is it was a little sticky because I worked there and I had to speak with the program manager, program director, and the CEO. And I explained that my job is to assist and protect my clients' patient rights and help them coordinate the care that they need. That is within my job description. And it would be hypocritical that we violate our own clients' and patient rights, but yet expect staff to make sure that their patient rights are protected when they're receiving services outside of our organization. So they really couldn't do it. They were like, well, she's right. The doctor wasn't happy. But again, this wasn't about me. This was about my patient who had they had severe treatment resistant schizophrenia. And this patient arrived 15 minutes early and ended up waiting an hour and 15 minutes. And that's not fair. And it's understandable. Doctors do run behind because they want to take more time with their patients. But also, there could be emergencies, and they can't tell you that they had an emergency in the office. So if for some reason a doctor is running late or a medical provider and they are not typically, I would personally just assume that something happened during the day that ended up delaying all the appointments. In this case, though, this particular medical provider, and everybody knew it, but no one said anything, was always late. And it was just an unfair balance and inequity in the healthcare system that impacted my client negatively. So that's one example. Now, as a veteran, I sometimes have some of my healthcare taken care of at the VA, and then other times, like for my specialist appointments, I go to private healthcare. So at the VA, I've had incidences of delayed care when there was tangible evidence that I needed immediate referrals. And one of them was I had to advocate for months with my primary care doctor to order an MRI because I had been seen by the VA chiropractor, and he ordered x-rays, and the damage in my neck had progressed to the point that it was so bad on the x-ray that they actually picked up shadows from my muscles twitching in my neck, trying to keep my discs in place. So on the report, in the follow-up, they deferred to my PCP and wrote that a referral and MRI is needed ASAP because of all the issues that were going on. Well, my PCP was not putting the referral in. And I kept saying, here's the report, here's the recommendation, here's the clinical evidence. It got to the point that 6 months later, I'm still fighting this, and I had to bring someone with me. And I finally got the doctor to order an MRI. And within 24 hours of having my MRI results coming back, the doctor called me because they were freaking out because the damage was so bad that my discs were pressing on my spinal cord and I was leaking spinal fluid. And there could be a huge fallout medically when that happens. So my doctor was advising me if I had certain symptoms or issues, I needed to go to the ER, and just giving me a whole list of, what to watch out for if there was any issues with my neck before getting into the specialist and getting surgery. In that case, I filed a formal patient written complaint because there was documented medical evidence that I needed this consultation and a follow-up because I was going to need surgery. The other reason why I filed a formal written complaint is when I went into my clinical records, because most providers now they have electronic records and we can at least read a summary. At the VA, we can read the actual note. And every time I was going in and asking for this referral and this recommendation to be done, the doctor had wrote in my clinical note that I was demanding an MRI and a referral. But when that MRI result came back and she was calling me 24 hours later, I said specifically, now you know why I was advocating so much to get this done. And she goes, I'm so glad you did. I said, oh, great. I'm glad we're on the same page. So if you could amend my clinical note and change it from demanding to advocating, I'd appreciate it. When she didn't do that, that's when I filed a formal complaint. But I also CC'd my congressman's veteran liaison on the email, because that delay in care could have had some serious consequences. Like I could have had seizures. I could have blacked out. I could have had damage that was permanent, that could have caused permanent nerve damage and loss of feeling. In that instance, I will say this took about 18 months from start to finish with the formal complaint, but that provider is no longer at the VA. I was just told that they resigned, but it was just seemingly what a coincidence that they were going through this major investigation and then they're not there anymore. Literally it was the next day. So that's how I address that. Now in healthcare systems, a lot of them will have what they call a patient advocate, a patient experience representative, a patient coordinator, a patient representative, a patient, they have so many different names, like an adult advocacy coordinator. They have so many different names for a patient advocate. So how do you figure out in a healthcare system who that patient advocate is? So a lot of times I'll ask the support staff, or I'll call the general number. I'll say, I had an appointment here and there was a situation that happened that I think may have violated my patient rights. So I would like to speak with whoever, the department that handles, patient advocacy and patient rights formal complaints. And then they'll transfer you. But before they do, ask them for the extension in case you get disconnected. The other thing you can do is whoever the director is of a particular department, you could put in writing what happened as well. Now, I'll have another example. And just so you know, I have a couple examples from different hospital systems, but this next example is from the VA again. So I'm not bashing the VA, it's just how I wrote this up. But I had a provider last year doing telehealth appointments who missed 2 scheduled appointments in a row. In July of 2021, they missed this appointment. And I called the office and I said, well, I had a telehealth appointment scheduled with this provider and they're not, I'm sitting here for 30 minutes. I got bounced out of the system and they had told me, oh, that, Dr. So-and-so has been having problem with the technology. I said, okay, well, let's reschedule then. No big deal. I understand, because everybody struggles and we need to give the benefit of the doubt, right? At least once, maybe twice, depending on the situation. So it was rescheduled for 3 weeks later in August of 2021. And that provider didn't show again for the telehealth appointment. So I called the office and I said, hey, this doctor missed my appointment last month. And we rescheduled for 3 weeks later. And now it's August. They're missing my appointment again. And I'm about to run out of medication. It's getting late on my end. Sorry. I spoke to everyone in that department, including a supervisor, clinical support staff, and I told them what the issue was. This provider missed 2 scheduled appointments of mine in a row because they were having technical difficulties. And I said, to circumvent this in the future, if she missed my appointments, she missed other people's appointments. And that if she can't figure out the technology, then they need to call their patients. I said, now I'm going to run out of meds. I also spoke with the pharmacy to see if they could get a hold of the doctor or some other prescriber in that department just to do a 1-month refill on my meds. The pharmacy didn't get a response for 6 business days. Now, it was not detrimental that I ran out of this medication. Nothing detrimental happened. However, being the person I am, I'm as a veteran who had a provider that missed 2 appointments in a row because they can't figure out the technology and no one else in the office is stepping up to assist patients. If I'm having this problem with all of my skill set, What's happening for other veterans? What if that day that provider missed an appointment with a veteran who was suicidal, or a veteran who has diabetes and was about to run out of their medication, or heart medication, or cancer medication? The whole point of it is while it was not detrimental to my health, knowing what I knew, that 2 months in a row, this provider missed my appointments and everybody knew this person was having problems and no one in the department was doing anything to circumvent and address and minimize these issues and assist the patients with medication refills, I filed a formal written complaint. I filed the complaint with the patient representative at the VA. I also forwarded that formal complaint to my congressman's veteran liaison. Sorry, I gotta take a drink of water. On top of that, my goodness, I'm losing my voice. On top of that, I also contacted one of my state senators who also sits on the VA Senate committee. And I pushed this thing all the way up because this particular situation could lead to gross medical negligence. And like I said, it wasn't so much about me, but it was about my fellow veterans who may have had a medication that was life-threatening if they didn't have it, or if they were on a medication that caused severe withdrawal, and not necessarily withdrawal from a pain medicine, but there's many other medications like Lyrica, Neurontin, some mood stabilizers that stopping those medications immediately can be dangerous to someone's health. So in that instance, I was filing to protect my fellow veterans. Now, the VA isn't all bad. I've had some issues with a couple other Metro Health. I used to get infusions through their pain management and wellness clinic. But a couple years ago, they kept calling and canceling my appointment and then rescheduling it. So then once they rescheduled my infusion, they called back a week before the next rescheduled infusion to reschedule again. And I said, well, wait a second. A couple months ago, you rescheduled it. You didn't have any openings for 2 months. Why am I constantly the one that's being canceled and rescheduled? What's going on? So the person doing this, the canceling and rescheduling, was the secretary of that department. And that person informed me that what she was doing was just rescheduling the person that was scheduled last on that particular infusion day. I said, well, that creates an inequity, and this is why this is happening to me consistently, because I'm the one that's getting rescheduled. And you are not licensed to make medical decisions, and you don't know what's appropriate or how to determine medical necessity. So I'm like, this is going to create detrimental harm on my overall physical well-being. So I ended up calling Metro Health's patient representative experience person. Or patient experience representative. It's like a real weird name. And I broke down what was happening, how the secretary, and again, I am not bashing admin staff. This was just the particular situation. But I explained that the secretary of the department kept canceling and rescheduling my appointments. And when I inquired as to why, and finding out that they were just picking the last people scheduled for that day, I explained that this was a violation to timely access to healthcare and treatment, and that she was making medical decisions without being licensed. It was outside the scope of her practice. And then I followed up with an email, so they had it in writing. So 2 days later, they called me back, and I was back on the schedule, and they told me that with a follow-up letter that they had decided that this person would be better suited in another department. So that person was not going to be interfacing or scheduling appointments like that again with the patients, because she was acting really outside of her scope of practice. But in the same time, it does fall on the prescriber to identify and know, who's on the list that day for an infusion, so that that doctor can make the decision of the medical necessity, access to treatment. So if someone was being rescheduled, such as myself, is it fair that I'm not getting the treatment where someone else is getting it every month? And that's where inequity happens. And that's another reason why I address this. type of issues. So let's see if I have any other examples before moving on. Okay, another example of a patient rights violation. This is like a form of withholding my medication and what I can't say the word right now. So basically, they're threatening to withhold my medication in the emergency room department. I presented to University Hospital ER with severe lower right abdominal pain, nausea. I couldn't walk. At the time I was married, my ex-husband was present. Long story short, I had an ovarian cyst that ruptured, but they didn't know that yet because they had not ordered tests yet. And when the doctor did order tests, one of them was to insert a catheter. So the nurse came in. I didn't know this test was ordered, and it was not explained to me why it was ordered. And I'm sitting there going, why would a catheter be ordered to be inserted? Not that I was against it, but I was confused. So I asked the nurse. And the nurse said, well, the doctor ordered it. And I said, well, why? It doesn't matter why. I said, well, yeah, it does matter. I have the right to know why certain medical treatments or tests are being ordered. And, you know, I was in severe pain, and I can tolerate high pain. And my pain was so bad. I was like kind of getting that feeling of seeing stars, on the verge of passing out or on the verge of vomiting type of pain. So this nurse said that I could not get my pain meds that were ordered intravenously until the catheter was in. And I said, so are you telling me you're going to withhold my medication, my treatment as prescribed by the doctor, if I don't consent to this catheter, they don't know why it's been ordered? And at that point, she just kind of looked at me and she's like, well, you know, that's the deal. And I just looked at my ex-husband. I said, I need you to go to the front desk and bring the other nurse here ASAP. So he did that. I explained the situation. I was like, you better get the doctor in here because I'm about to make some phone calls and heads are going to roll, because I was not in a good mood that day. So normally I'm not that blunt or mean about it, but I was miserable and I felt like I was being pushed to make or go along with some type of medical intervention that I did not know the reason why. So then the doctor came in and it was explained to the doctor what the situation was. And he said, well, it's right in the chart here. Why? And they explained that they wanted to expand my bladder to check something on an ultrasound. And I was like, cool, now that I know. And he did apologize for the nurse's actions. And that's fine and dandy, but when I was well enough after discharge with that incident, I did follow up with a written letter of concern and complaint to the director of the ER, because no medical provider of any kind can threaten to withhold medication. They have to explain what is being ordered and why, and you have the right to refuse. I had the right to refuse the catheter for any reason and still legally be given and having the right to have that pain medication. So those are a few examples of some pretty extreme patient rights violations, how I processed through that and what I did to address it. And like I said, in a couple incidences, it was more about addressing it on a systems level because I knew if it was impacting me, it was impacting other patients. Now, tackling healthcare patient rights violations can be daunting, and it's a very overwhelming space of information. But it's important to know what your basic rights are, because lately we've been hearing the term medical gaslighting, right? So have we not heard that term on social media? Medical gaslighting is actually a form of a patient rights violation. So if a doctor is telling you that your illness isn't real, and I had that happen with a neurologist, and I point blank said, well, if you don't believe that my diagnosis is real, then why are you seeing patients such as myself and billing for that? I said, so are you really just doing it for the money? Because then it would be kind of a fraudulent practice and fraudulent billing. And the neurologist just looked at me. Now, again, I'm a very well-versed patient, and a lot of medical providers and systems just don't see me coming. Well, at least some of them should by now, like the VA and Metro Health, because I've done a lot of advocacy on patient rights, violations and whatnot, and addressing issues in both of those systems. So you would kind of think that they would know who I am by now, right? But, staff roll over. So, these are, like I said, they're extreme examples, but you have the rights to know what's being prescribed, what treatment or medical interventions are being recommended and prescribed. A lot of these instances show that it was a lack or violation of dignity and respect as a patient, or people making medical decisions like when to schedule someone for an infusion because the problem was they were short nursing staff in the infusion, but having a non-medical provider make that medical necessity decision is a patient rights violation, which could in the long run, not necessarily in my case, could lead to some medical harm or gross negligence. Now, am I bashing doctors or nurses? Absolutely not. I have a lot of friends that are doctors, nurses, physical therapists, dentists, surgical technicians. I've worked with some fantastic medical providers, and in the space of advocacy in the veteran space and fibromyalgia space have collaborated with doctors doing interviews and informational videos. So this isn't to say all doctors are bad, but also to recognize that you do have rights and you do have the right to be treated with dignity and respect, but also be treated as an equal team member of your medical treatment team. And I will give you more information on that you can follow up on your own time that complements what I reviewed in this session today. Now, as I said, these are my personal experiences and some of the measures I took to ensure that not only that my healthcare needs were met, but any patient rights violation that was reported, I did so in appropriate channels to ensure that it would help protect other patients in the future. So the next thing I want to review is what I call proactive patient preparedness. That sounds pretty serious, but it's just, I like acronyms, so I could be like, PPP, y'all. Where's my fire crew at? Make sure you got your 3 Ps in place. Proactive patient preparedness for your appointments. Some of these things will help, hopefully, reduce potential instances of where you might contend with some patient rights violations. So these are some tools so that hopefully you will never have to endure any type of patient rights violations, especially some of the examples I outlined. One thing is to research online what your state, province, region, or country has in place to protect patient healthcare rights. Also inquire of all of your doctors and medical facilities if they have something like a bill of patient rights or patient rights code or healthcare rights policy and ask for a photocopy. Identify if the medical office or healthcare facility, do this ahead of time before any potential patient rights violations. This is just something, be prepared. Like preventative measures are usually better than reactionary ones. So identify if your medical office or healthcare facility has a patient advocate on site. Sometimes those patient advocates are called a whole plethora of things from like patient rights officer, client's rights officer, patient experience representative, patient advocate, patient coordinator. If there isn't one on site, check with your state, local, county, province, or region if there is an independent nonprofit organization or a ombudsman in place to assist patients when there are issues with receiving healthcare or patient rights violations. So I live outside of Cleveland, Ohio, and I know how to contact all the patient advocacy departments at a variety of medical health systems. And that is through my experience in the field that I worked in, but it also as a patient. And keep in mind that outside of Cleveland, Ohio, like we're called like a medical mart. So we have a lot of healthcare systems here. But if you're going to the same ones or routine medical facilities, check and see if they have some type of patient advocate department. And again, if they don't, search online to see if there are any independent advocacy organizations for patients, and just have that information on file as a just in case scenario. Let me see here. The other thing is, if possible, identify the medical director of the clinical departments you receive treatment from. So, if you are, receiving mental health ongoing, or pain management ongoing, or rheumatology ongoing, it's not a bad idea to find out who the director is. Just, again, being prepared in the event that there is an issue and a potential violation. You already have that information on hand because you looked it up ahead of time, and that helps reduce a lot of stress, because especially living with a chronic illness, fibromyalgia, lupus, any medical condition, we already are kind of high wired in a lot of ways. And so stress seems to hit us harder than if we weren't chronically ill. And so sometimes having those things in place and being a proactive, prepared patient, that will minimize some of the stress that will be associated to that stressful event of a patient rights violation. If for some reason you are experiencing difficulty or barriers to healthcare, or obtaining referrals, or ordering tests, bring someone with you. Honestly, even if you're not having any issues, I always recommend, when feasible, to bring someone with you. I also know in light of COVID, it's been more difficult, or some healthcare systems will say, you can have someone with you if it's, necessary, or if you need an assistance, navigating the facility or whatnot, what have you. But whenever possible, I say be proactive and have someone come with you every once in a while to your appointments, so that their presence is known. But in an instance where, if you can't get tests ordered, and like my case with the x-ray where it showed I needed follow-up and an MRI, and that's why when I was hitting a wall, I ended up bringing someone with me. So I had a witness. But 9 times out of 10, if you have someone with you and you had this physician that's kind of been resistant with ordering tests or whatnot, when you have someone present, they're more likely to be amicable about it. And again, not all doctors are like this. I'm talking about in the specific incidences. The other thing is, if you have a provider that is refusing to order tests or a referral, and it is completely appropriate to do so, personally, when I've had that happen to me, I've asked that medical provider if they wouldn't mind documenting in my clinical note that I requested a referral and that they declined. 9 times out of 10, they're going to put the referral in, because they don't want to document in your clinical note that you asked for a referral and they refused, when it would have been appropriate to do a referral. And an example of that is, at times my autoimmune, like inflammatory markers, will go high. And they know I have some type of autoimmune disorder that seems to kind of flare up and go into remission. And a newer physician who wasn't as familiar with my case, I was going through this spike where my levels were up, and it was a good time to send me right away to get tested to see if they could figure out exactly what autoimmune condition I had in the moment, right? And this physician didn't know, and I had to go through and explain, and they kept refusing. So I asked them, I said, okay, since you're declining my request, will you please document in my medical note that I requested blood tests and labs to be ordered due to I had increased inflammatory markers, and that you refused. So that provider decided to just go ahead and put the orders in, and I was able to get the test done that day, which did end up showing I have a connective tissue disorder. So, and it was one of those instances, like they had to test it in the moment, because once my inflammatory markers went down, it wouldn't show up. My test results will be normal. So that's just a little, thing you can use, that if they're refusing, you can ask them to document it in your clinical note. Let me see here. When And okay, so sometimes we relay stuff to our medical providers and they don't put it in our clinical notes, like how our medical condition is impacting our overall health. Like if it interferes with our ability to do chores or activities of daily living. If they're not documenting that kind of stuff, even though you're talking about it and you're telling them these things so that they can assess like how severe your condition is, and they're not documenting it, I like to use talk to text on my phone, like on my email or notes, and I'll write out using talk to text how my medical condition is impacting my health. And then I will copy and paste it like from my email onto my laptop on a Word doc, paste what I said on there, edit, make it look nice, and print it up. And the next time I go to the doctor's office, I ask the staff or nurse to put it in my medical chart. The other thing is with technology now, many facilities and doctor's offices have a messaging system. So from your smartphone, you can use talk to text and message the doctor, hey, I noticed that when we had discussed how my medical condition is impacting my ability to do activities of daily living, and it wasn't documented in my notes. So if you can add this into my chart, my message here, I'd greatly appreciate it. Robert, so one of the things that's great about this conference is that they're able to record and you can do a playback. You can, I do have a Word doc that I do have a blog, and I'm planning on putting some of this on my blog on my website. So I will get to that eventually, just not today. But it will be there. So Veteran Voices for Fibromyalgia, it will be on my blog eventually, all these tips that I'm reviewing. So other than that, one proactive way to reduce the likelihood of having the wrong type of fit medical provider for you is there are different tools online, such as, I got to pull it up, like healthgrades.com, or my notes kind of got out of order, but healthgrades.com, it is a website, and there's other ones similar where patients go online and they rate the doctors. You can go on healthgrades.com and put in fibromyalgia specialist with your zip code, and then it's going to pull up all the doctors within your area, designated area, and then you can go through and read the reviews, and all the reviews are done by patients. There are a couple other websites for, I don't know where the sheet went. I had so many, but there are other websites that are similar, like VetMD, another website resource that people laugh at, but I was like, no, go check it out. Angie's List. You can research doctors on there that have been reviewed, or what's the other one? Yelp.com. So there's these resources online like healthgrades.com and VetMD where patients actually go and give the reviews of the doctors. So how this can help you potentially reduce any risk of experiencing a patient rights violation is you can choose a PCP or any doctor or specialty using those tools online like healthgrades.com, yelp.com, read the reviews. And me personally, if I read a review of a medical provider and they had 10 patients grade them and they have, let's say, 4.5 stars out of 5, but then I see another doctor that specializes in fibromyalgia that's had 500 reviews and they're like a 4 or 4.5 or 5 stars, I'm most likely going to choose the one that has way more reviews. And it's not anything bad against the doctors that have less reviews, but a lot of patients aren't aware of such sites like these and tools online, or it could be a newly minted medical provider that's just starting out in the practice. So again, being prepared and researching doctors by specialty based on patient reviews, we're pretty straightforward, especially in a lot of the communities like fibromyalgia, chronic pain, lupus. We're pretty honest about our experiences on those type of sites. And but also keep in mind that it's completely normal for any medical provider to have a negative review, because sometimes patients and a doctor or nurse or whatnot, our personalities are like oil and water, and it's more of a personality issue than an actually medical health or patient rights issue. So the biggest thing is to be firm but fair with your healthcare. Does that make sense? Does anybody have any questions? Because we have a few minutes before we bring on the fantastic Carrie of My Several Worlds, but we have a few minutes if there is any specific questions. And yes, Dr. Tracy is amazing. I bet you.
Hoping you look for the questions.
She has probably 1,000 patient reviews, 5 stars. I would not doubt it. I'd go to Vegas and bet on it.
Well, I really appreciate you, Kristal. There's a lot of great information in answering questions. So let me just go through some of the concepts. Questions. Okay, wake up. Carrie's in the backstage. We gotta get ready. Maybe I'll do some stretching a little bit here. So Katie says it's such an important mindset that is needed in the fibromyalgia community. You need to know we're equal team members and be proactive, right?
Right. And here's the thing. We, as patients for ourselves, often become complacent when we're not receiving the optimal care that we deserve. So I want you to reframe it like this. If this was a loved one, if this was a spouse, if this was your child, if this was your parent, would you tolerate any of these infractions happening to them? Especially a child. Like, I know my brother, when he was diagnosed with leukemia at 5 years old. So, and my mom, she's a very diplomatic. She's quiet. We look alike, but personality is totally different. I'm loud and proud. I'm out there. I'm a great megaphone. My mom, she's more of the subtle approach, but when you are dealing with your child is dying, are you going to be nice? Are you not going to be fierce? Are you not going to protect their patient rights? That same energy and love and support you put in someone else, I want you to invest it in yourself times 10, because you deserve to be treated in the same manner that you fight for your loved one's healthcare.
I think we absolutely agree with that. And look at these comments, like, thank you, Kristal, from Brandy. We're back with I think there's a lot of love happening and the end of the night here with the fibromyalgia community, despite any like brain fog and lack of coffee, for sure. And Karen says, you're wonderful. Maggie has a question for you.
Sure.
She says you can PM her afterwards if you need to. So,
wow.
Kristal,
what did they do to test? I would actually have to pull that up. They tested me for Eldonado syndrome, EDS, and there is a biological marker to it. And so that's what they were testing. And the reason why it led to that test is I was being seen by a new rheumatologist that specialized in fibromyalgia, rheumatoid arthritis, and like connective tissue disorders. And he did the diagnostic like manipulation manual test. And he was like, oh, you're double jointed, right? And I was like, what? He was measuring, like, literally, it's like, it's so freaky. And it makes so much more sense, like when I was a kid, why I could do splits without stretching, or why I dislocated certain joints, or why my ankles would roll out. So when he did the actual physical assessment and saw like my range of motion was well outside of, like, it was freaky. Even when I was watching him, I was kind of grossed out. So that's what led to him ordering the test.
Well, it's interesting overlap with EDS and on the sort of hypermobility in general, and not getting the physical exam. That's why we always talk about getting physically examined, because it's important to check, just like you said. And I'm not remembering the test off the top of my brain, but that is in my module for my clinical course with Dr. Karazian, whose name has probably come up a lot at this conference tonight.
Mm-hmm. So, and yes, all this information and even more personal and professional examples will be on my blog at veteranvoicesforfibromyalgia.com. So you all have been the first people to hear this presentation, And I'm sure we'll be the first to read it because you'll be waiting for me to put up all those tips so that you can save it.
Okay, so we have your website, and then for tomorrow and all that you're doing tomorrow, what's on the table that everybody watching now can tune in tomorrow?
So at my virtual booth, to tie in real quick with this discussion, there's a video you can watch called Patient Healthcare and Participatory Medicine, and it complements this discussion. It's also on my YouTube channel. So, because in my booth, you can't do a replay, but it's on YouTube, and it will complement this presentation, this talk, where I sit down with Dr. Danny Sands, who is the co-founder of Society for Participatory Medicine, and we discuss the role of medical provider and patient and how to both parties can actively engage in a person's healthcare in a proactive, positive manner and work as a team. And when you do that, it also alleviates the possibility of patient rights violations as well. So there's that. And then tomorrow I will go live with Coffee Talk with Kristal, a general Q&A at 11 a.m. ET time. And then again, I will go live at my virtual booth, Veteran Voices for Fibromyalgia, at 1 p.m. ET time to talk about how to strengthen your Veteran Affairs compensation claim for fibromyalgia.